So how would someone know if they have a sensitive nervous system?
I think if somebody's questioning whether or not they have a sensitive nervous system, they probably do. So you probably know. You probably also heard it from your parents growing up or whoever raised you, whoever was your primary caregiver. They probably have said things to you your whole life, you're so sensitive, or why are you so sensitive? And, take it easy, like relax, you're too tightly wound, or you're too wound up. So there, if you've heard things like that, especially going back to childhood, you probably have a highly sensitive nervous system. And you probably just know all of us can become more sensitive or more highly sensitive over time, or less sensitive too. We can kind of blunt ourselves. But I think other signs of having a highly sensitive nervous system are that desire to blunt. So a lot of people who are highly sensitive tend to gravitate more toward substance use or abuse, because they're trying to find a way to regulate their nervous system because they feel dysregulated. So they're seeking something to kind of ground it down. So that can be a sign. There's many other signs, volatility, emotional volatility, being up and down, a lot of mood swings. Those are all signs. Like I said, physically, food sensitivities, sensitive stomach, either wanting to overeat or undereat when somebody is stressed, especially undereat, but definitely overeat as well. It's just a way that people are seeking to regulate their nervous system when it's kind of unraveled. Also issues with sleep. Generally, if somebody has issues with sleep, that's a pretty good indicator that their nervous system is sensitive, especially if it's in response to something like a full moon. A lot of people feel that, or any sort of stressors. So yeah, sleep is definitely a big one. And just feeling overall, especially what I always call free floating anxiety, like anxiety without a tether, meaning it's not like, oh, I'm anxious because I have to be up early tomorrow for this meeting and I'm stressed about it, so I'm feeling anxious about that thing, but just like I'm overall so anxious and there's no reason to be anxious, but I'm just feeling anxious and I don't know why. That's a pretty good sign, especially, if that happens once every 10 years, whatever, that's just being a human. But if that is a theme in somebody's life, there's a good chance that the nervous system is overburdened, overwhelmed, and that's probably because it's highly sensitive to the input. Again, whether it's external stimuli or internal things that we're putting on ourselves, it's overloaded.
Yeah, I think this is probably becoming very clear for people. Just one follow-up question here. Are there specific conditions that are associated with it? It sounds like you're talking about like a generalized kind of anxiety, which is how it showed up for me. And I know for you, it showed up as kind of like an autoimmune thing. So are there other ways that will show up for people in a diagnosis?
Yeah, absolutely. So definitely any sort of mental emotional concerns that are chronic. I was a highly sensitive child, and always had issues with sleep and anxiety, and that's kind of how things started for me. And so but eventually, especially with a child, if they're kind of forced to suppress it or forced to conform to what society expects of them, then often it will show up physically, because all of those feelings, all of those sensitivities are still there, but they're not having an outlet of expression. And so that often shows up in the throat chakra issues. So inability to express oneself, or the opposite, screaming, because they feel like they're not being heard. So a lot of screaming issues, or inability to express oneself or stand up for oneself. A lot of heart chakra issues as well, because as this gets trapped, everything below it gets trapped. And so there can be chest pain, asthma, issues with breathing, feeling like one can't breathe. And then, of course, like I said earlier, sensitive stomach, a lot of digestive issues, because the digestion is ruled by our vagus nerve, or the parasympathetic rest and digest branch of our nervous system. And if that's dysregulated, then a person won't digest. So there could be a lot of gas and bloating, belching, indigestion, reflux, constipation or diarrhea, food sensitivities, all sorts of things like that. So it can really show up anywhere in the nervous system. Headaches too, are definitely a sign. For me, as you said, I was diagnosed with autoimmune issues that went back to childhood, and that's a way that, you know, our protective system, my protective system, is now turning on me, and that's because I'm kind of suppressing things that shouldn't be suppressed, that need an outlet, or I'm not being heard. You know, I always had a sensitive stomach as a kid and was always having stomach aches. And it was like, oh, you're just anxious. It's your nerves. You have a nervous stomach. When really I had celiac disease and a fulminant autoimmune issue that was sort of destroying my entire body and nervous system. And, but because it wasn't well understood, it was just, oh, it's your nerves, you know, and obviously that wasn't true. So, so I think, but since the parasympathetic rest and digest vagus nerve branch of our nervous system is so critical for digestion. If there's a lot of digestive issues that somebody's had throughout their life, or even just temporarily, there's a good sign that the nervous system is overwhelmed and somebody's in fight or flight, or what we would call sympathetic dominance. Like they're that hypervigilant nervous system of running from the tiger is way over magnified, and that calm, relax, gentle, recover, restore has gone out the door.
Yeah, this is super clear. It's also helpful to not just understand the symptoms, but why the symptoms are happening related to your nervous system. So thanks.
Yeah.